Hi, Dr. Goodman. How are you doing?
Okay, how are you?
I'm very good, thank you.
Good. I'm looking forward to our talking a little today about, I'm going to say morning sickness. I'm going to say morning sickness because it's such a well-known term. And now I understand that a more technical term is nausea and vomiting of pregnancy. Is that correct?
That's correct. And it's just because, morning sickness doesn't necessarily have to happen in the morning. It can happen at the end of the day. It can happen all day long. So I think they wanted to just address the nausea and vomiting in pregnancy as an issue in and of itself and not give it sort of a very sort of stereotypical name.
Right. And how has morning sickness? Oh, I'm still saying morning
It's
sickness.
okay. That's okay.
How has nausea? But I think we should emphasize that because the term is used so much. I think we should emphasize for the health power audience that, in fact, it can occur all day
Right.
or
Absolutely.
any time of the day.
Mm-hmm. Mm-hmm.
Is it just for information? Is it more common in the morning or not?
Typically, yes, and that's why it got its name. But it doesn't. It starts in the morning, and so it doesn't address that it can continue all day long, and
I see.
that's why we've adopted that. And it's extremely common. 85% of pregnancies, which translates into like 3.4 million pregnant women a year. And because it's so common, a lot of people sort of take it lightly when a lot of women can be really, really miserable.
Yes. Now, also, while we're talking about patterns, is it more common in the early part of pregnancy, or is it as common throughout pregnancy?
Typically, it's an early pregnancy, as early as 4 to 6 weeks, and usually it resolves itself after the first trimester. So a lot of women, the nausea and vomiting in pregnancy may be the first sign that they're pregnant to them, and it may even happen before their first pregnancy appointment. So it's really important for women, as you know, to contact their doctor early in pregnancy so that we can help them with these symptoms, so that they're not miserable, and give them the different the treatment options, so that they don't have to be miserable.
Okay. Now, you used a key word there, which is helping women who may or may not have these symptoms. How might one help? What are the best things for women to do who have nausea and vomiting in pregnancy?
Well, we always want to start with conservative management, meaning dietary and lifestyle changes. So, as physicians, we may advise a woman to cut out the greasy foods, to cut out, having large meals and go to smaller meals more frequently, so that she always has something kind of on her stomach, to go to more bland things. That's where the crackers come in that all the women take, myself included, I took during my pregnancy. So these are things, exercising to help with digestion. Ginger is another one that often has been used as a first-line treatment to, try and see if we can't help a woman with nausea and vomiting in pregnancy. And if it progresses or the symptoms become more severe or not treated by the first line, by the conservative management, then that's why I'm so thrilled about being here today and partnering with Duchenne USA, is we do have diclegis, which actually can help with
I'm sorry, you do have, what is it?
diclegis. That's the only FDA-approved prescription treatment for nausea and vomiting in pregnancy. So it's the only
I
one
see.
that's FDA-approved for nausea and vomiting in pregnancy, and it's safe and effective. It's been tested during pregnancy, and we know that it's safe. So when women when the first things don't work, they can be reassured that if they need to go to a prescription, that it's safe.
I see. I guess it would be the obstetrician or the OBGYN would be the best person to go to if one has the problem?
Absolutely. Well, or whoever her healthcare practitioner is, if that's a nurse midwife. But she does need, for the diclegis, she does need a prescription for that against the only FDA.
How are you spelling the diclegis?
It's Diclegis.
Okay, diclegis.
Yes.
Okay. Now, where on the internet might a woman receive more information about nausea and vomiting in pregnancy?
On the website, Diclegis, Diclegis, and if you go on there, there will be Dr. Lisa's tips in pregnancy, as well as you said, information, education, and empowerment for these women, who are suffering from nausea and vomiting in pregnancy. So it's a great website.
Of course, but most women are not going to know about that website by name. Is there another way to get to that information?
Well, I imagine it would come up if you Googled nausea and vomiting in pregnancy, or maybe even morning sickness.
Morning sickness.
Yes.
Probably. Okay. All right. Are there any other specific things that you think we should mention to our audience? By the way, is there any difference in the incidence of nausea and vomiting in pregnancy by race or ethnicity?
Not that I know of. Not that I know of, because it's usually related to, what's going on in pregnancy. Now, that's not to say that there aren't some things that might cause you to be at an increased risk for nausea and vomiting in pregnancy, like family members who've had it before, or if you've had it in a previous pregnancy. And even though there's a correlation, kind of the individuality of each pregnancy is going to be different. So, even if you had it in the first pregnancy, you're going to be at increased risk for the next pregnancy, but that does not guarantee you having it in the next pregnancy. And then there are some medical conditions like migraines and things like that can be associated with at a higher correlation or increased risk. But again, it does not guarantee you having that.
Right. Okay, well, this has certainly been useful information, and I'm sure our Health Power audience will appreciate our women especially knowing much more about nausea and vomiting in pregnancy, and just summarizing that even though many women know of it as morning sickness, it is also known as nausea and vomiting in pregnancy. There are many things that women can do, I think many things, in terms of modifying their diet, in terms of exercise and so forth, and of course those soda crackers to help, and then there's also medical treatment for it.
Yes, you are absolutely correct. Thank you so much.
Well, I enjoyed talking with you, and I'm sure your message was informative, and have a good day.
Thank you. You too.
All right.